Hello and welcome to this video just with a little bit of information about C-section scar soft tissue therapy. About a quarter of births in the UK are C-section and that number is slightly on the increase, so it's by no means uncommon at all. The surgery itself is two surgeries in one. Number one, the surgeon cuts through the abdominal wall, and number two, the surgeon will cut through the uterine lining. So it's two major abdominal surgeries. Given that there are two surgeries in one, often the aftercare from that is slightly lacking or non-existent for a lot of people. So I'm going to tell you a little bit about how scar therapy can be really helpful, by how soft tissue therapy can be really helpful for that. So number one, you have the scar area, and often people complain that it is painful and it is bumpy and it is numb. So a little bit of gentle movement in the area can really start to help that. First of all, numbness, we're stimulating the nervous system. Okay, so hopefully that will start to come back and you'll start to be able to feel a little bit more. Secondly, if it's painful, obviously you're not going to touch too hard on anything that's painful. It's very much a two-way conversation between myself and you in terms of what's comfortable and what is not. And then we've got that bumpiness as well. So as we move over the tissues, it starts to break down scar tissue and adhesions, and it just moves the tissue that can become quite stuck, literally dehydrated, and it sticks together post C-section. So not only have we cut through about 7 layers of muscle, but there's also lots of fascia, connective tissue that runs all the way around the body that is also cut through as well. So that can cause this kind of sticking in the area. So soft tissue can really help, soft tissue therapy can really help to smooth all of that out. Going a little bit more globally from the scar itself, other symptoms that women find that they can attribute back to their scar is obviously abdominal pain, pelvic pain, back pain, shoulder pain, headaches. All of those things can associate from the scar. It's in the middle of the body. Okay, and I'm going to just show you a little model here. Okay, so this is, we could call this our abdominal cavity. So you can see there that's completely elastic. So it's movable, just like our abdominal cavity. So if I then got a pair of scissors and I cut, so that's elastic there, if I cut that, the shape of this structure would be compromised. Okay, and then if I then got my stapler or my needle and thread and I sewed it back together again, it's never quite going to be exactly the same as it was before. Okay, and that is sort of a similar idea to what we can attribute to a C-section being. Okay, so it's never quite the same. So if I pinch this side here, okay, not only has it changed the shape of that, but it's overstretched a little bit more at the back here. So that's how you can attribute C-section into back pain. It can refer into the shoulders. It can refer into the headache as it pulls on the fascia, which runs all the way around the body. So C-section scar therapy can really help other areas of the body as well. Constipation is often a complaint post C-section too, so we can do colonic massage just to get the bowel stimulated and try to get everything moving again as well. Sleep and relaxation. If you are very recently, if you have a newborn, then sleep and relaxation is you're probably thinking, sorry, what are you talking about? But soft tissue therapy can help to stimulate your rest and digest part of your nervous system. And that's really important that we just try and get a little bit of that rest and digest into our day, particularly for our health, for stress levels and everything else. So soft tissue therapy can also help with that too. Otherwise, pain and movement, so I'm talking about whole body movements, picking things up, putting things down. A lot of women are quite nervous for movement post C-section, very early post C-section, in terms of, restricting the movement that you do through fear of everything sort of ripping open again, which will not happen. Okay, but with my training background as well, I can show you and I can teach you how to move safely post C-section as well. It doesn't matter how old your scar is, you can always work with soft tissue therapy. So if your scar is old and you still have scar tissue underneath it, soft tissue therapy can be really helpful for trying to break that down and soften the whole of the area up. Now, a C-section may not have been on everybody's wish list in terms of a birth plan. So touching the area, moving the area, coming to terms with living with that scar there can also be really helpful too, as I teach you how to do some of the soft tissue techniques yourself. So if you have any other questions, please do feel free to get in touch. But otherwise, take care and I hope to see you soon.